Well, good afternoon, everyone. Breaking news, story we've been covering all morning now. 4 people dead, 63 injured after a Metro North passenger train derailed.
Let's talk about this a little more in depth, though. We are getting some information out of the area hospitals. Again, 4 people were killed at the scene, but 11 people are in critical condition at the hospital, 63 injured. We have joining us here on the set Dr. Ed Kornel, neurosurgeon and assistant clinical professor at Weill Cornell Medical College. Doctor, thank you for being with us. First off, we were talking to Dr. Steve a little bit earlier, our doctor here with PIX 11, about the impact of these trains and the fact that windows were blown out. 3 of the 4 that were dead were found outside of the cars. Now we're talking about the 11 people who are in critical condition. What kind of injuries are we possibly talking about?
Well, first of all, I just want to express my condolences to the families of those who lost their lives in this, and offer the best wishes and prayers to the injured, the 63 who are injured, and wish them a speedy recovery. This type of an injury where there's this tumbling, where it throws people around. People are not wearing seat belts, so they're being thrown around. And what's so susceptible to injury is the spine, especially the neck and the head. People hit their heads against the walls of the train, against the seats, against others, and that can cause everything from a skull fracture to blood clot in the head, a subdural hematoma or an epidural hematoma. Those require immediate surgical attention. I don't know specifically with these individuals whether any of those suffered those traumas, but certainly spinal cord and spinal injuries are common. The neck is very susceptible to injury, and if there is a dislocation of the spine so that the joints jump over each other, or if there's a fracture, it can compress the spinal cord, and then of course you can get paralysis, and that needs to be addressed very quickly in the hopes of stabilizing the spine, which our EMS are outstanding at doing, and then requiring surgery to stabilize it. In the thoracic or mid-spine, that's also an issue when there's a compression. When you are thrown up and land on your back, you can get a compression fracture of the vertebrae, and that causes an injury to the spinal cord as well. And in the lower back, it's very common to get a compression fracture. You fall on your tailbone, you get a compression fracture of the lumbar spine. That can cause a lot of pain. It can also injure nerves in the lower part of the spine. So those are a big concern. But in a crash like this, also you get people caught under the train. I think that happened in this circumstance, and you get people caught under seats and under other objects, and that can cause injury to the pelvis. And pelvic injuries can be very serious, because not only do you worry about the fracture of the bones in the pelvis, which can actually bleed quite a bit, but you get tearing of veins in the pelvis, and there are a lot of veins in the pelvis, and when you get those injured, you can have very quick blood loss, and that's what can lead often to fatalities very quickly.
Doctor, in an accident as horrific as this, when you first go on to the scene, can you expect to see a lot of folks who are almost a calmness about them, in shock?
Well, that's very correct, because initially with that adrenaline rush, it actually prevents you from being able to recognize the pain and the injuries. It takes a little bit of time, from minutes to sometimes even a half hour or so, before someone may realize that how badly they've been hurt, and the pain doesn't register right away.
Well, we don't know how many people were actually on those trains. It looks like, according to the governor, everyone has been accounted for, which is the good news there, because I know they did have crews out in the water earlier. When we're talking about the 11 that are in critical condition right now, when we look at the train, even if they were on those first 2, is what we would probably have to assume the impact of that. And we've all ridden trains before, and I stand up all the time. I don't even think about it. And you're so caught off guard. Is that where a majority of those very serious injuries happen, if you're not sitting down?
I think you're right. I think even if you're sitting down, I think a lot of these people, it was early in the morning, they were sleeping probably, so they weren't prepared. They couldn't grab onto something and hold on and prevent themselves from being thrown around or thrown out even of the train. So I think you're right in that if you have the ability to anticipate something, you can grab onto something, you can prepare yourself. In this case, I think most people were totally unprepared. and that may have added to further difficulties and further injuries.
Well, I know we're trying to get some word from area hospitals. I had heard earlier there were a number of injuries, and so they were scattering the patients about to about 4 different area hospitals.
Well, that's
right
the
now.
fortunate thing, is that they were in close proximity to
Right.
excellent facilities that have major trauma centers, so they could be very quickly triaged and treated properly. If it had been in a more rural area where there weren't many hospitals and many trauma experts, it could be even more fatalities, because for some of these injuries, you really need to be able to treat them immediately. And if you don't, then it's too late.
You know, we've heard the phrase a lot this afternoon, no seatbelts on those trains. I wonder how long it's going to be before they put into law seatbelts required on those trains.
Well, we were talking about that earlier, and you'd need the kind of belts that we have in cars that go across the chest that hold you not just like on an airplane across the laps, because then you'll still be in a roll like this, you'd still be thrown around too much. You need a belt across the chest, and then of course airbags would make it much safer, but that's a whole big, I'm sure, socioeconomic issue, and who would use it and who'd be willing to put on their seatbelts,
well,
and who's going to police
big question,
it.
Of course. I know there's been talk about it in the past, but certainly not the case, at least right now.
Doctor, thanks for stopping by.
You're very welcome.
Thanks for being here, Dr. Kornel.
You're welcome.
All right.